If you have knee pain and you'd like exercises to improve your strength, improve your flexibility, and decrease your knee pain, then this video is for you. I'm Dr. Dave Candy, and in this video, I'm going to show you 2 exercises to biohack your nervous system into better flexibility and better strength, and help you to decrease your knee pain. Now, the first exercise is going to be one to improve your knee flexibility and particularly your ability to bend your knee. A lot of people, when they bend their knee, they have stiffness in their thigh muscles or quadricep muscles, and your kneecap sits inside the tendon of that quadricep muscle. So the more you bend your knee, the stiffer and tighter that muscle gets, and the more compression it puts of your kneecap up against the thigh bone. So to improve your flexibility in the quadricep muscles, we're going to start out with a knee bending exercise in sitting. And to do this, you want to bend your knee as much as you can comfortably. And I emphasize comfortably on this, so don't bend it as far as you possibly can. Just go to the point where you can without having pain. Then cross your other leg over top of it. Now you're going to kick the sore leg into the opposite leg and hold that position. Again, it's not a maximum contraction. In fact, it's just a very gentle kick. All you want to do is activate the thigh muscles, the quadricep muscle of the sore leg. And hold that for about 5 to 10 seconds and then relax. Then you're going to use the opposite leg to help pull it into a deeper stretch. Now what that does is it activates this muscle, and then after it relaxes, your muscle goes through sort of a reset period where it becomes easier to stretch. That's a neurological principle known as autogenic inhibition, meaning the muscle inhibits itself. So you turn it on for a little bit, and then turn it off, and then stretch it a little bit farther. Now after you've stretched, then you want to fire the opposite muscle, the hamstring muscle. This uses another principle known as reciprocal inhibition. So when you fire the hamstring muscle, the quadricep relaxes. So you pull back using your hamstring muscle and just hold that position. Again, this should all be pain-free, so don't push it into the point of pain. And then after you've done that, now you're going to kick the quadricep muscle again. So now you turn this one back on, hold 5 to 10 seconds, and then use the opposite leg to pull it back a little bit farther. Now fire the hamstring muscle again and pull it back a little bit farther. I'll repeat that from the side view just so you get a different angle of it. So you start with the knee bent just to the point where you can comfortably. Cross the opposite leg and then kick this leg out. Hold that 5 to 10 seconds and then relax. Use the other leg to pull it back farther. Now you're going to fire the hamstring muscles. Pull the knee back under your own power. So now you're kind of strengthening the hamstrings while stretching the quads. And then relax. Pull back a little farther. Now kick the quads out again. Fire here. And relax. Pull back a little farther. Fire the hamstrings. Now if you get to a point where you're hitting the back of the chair, just scoot a little farther out in the chair. Now you have some more range of motion to get it back underneath of you. Fire the quads, relax, pull back a little farther, fire the hamstrings, and relax. So that's the first exercise. Now the second exercise is a strengthening exercise. And this is particularly a strengthening exercise for people who have pain when squatting or going downstairs, where you're bending your knees at the same time that you're producing force with your thigh muscles. And again, if your thigh muscles are producing force, that compresses your kneecap. And the deeper you go into a knee bend, the more compression there is on the thigh muscle. So it is helpful to do the flexibility exercise first, particularly if you do have some stiffness in your thigh muscles. But next we want to help you to be able to bend your knees a little bit deeper without getting the pain. So you're going to start out just going into a squat, just through the range of motion that you can. A couple important pointers on here. You want to just set your feet in a comfortable position. You don't necessarily need to force them straight forward, but just set your feet where they fall naturally. Now you want to turn your knees out to align with the toes. Now, after you've done that, just go into a position where you feel comfortable. So a little mini squat. So again, set the feet, line knees over toes, weight on your heels, and sit back just a little bit. You shouldn't have your weight out forwards because this fires your quadriceps more and puts more compression force on your knees. So make sure you're sitting back as you're doing this, kind of putting your weight back on your heels. Now hold this position. However deep you can go, you're going to hold that position. If you're having pain, back off, come back up a little bit, and just hold that position. Hold it 5 to 10 seconds. And you're turning your knees out the entire time, firing your glute muscles. And then once you've held that, then go down just a little bit deeper. It uses what's called the force velocity curve. And essentially what that means is that it's easier to lower a weight than it is to raise a weight, and it's easier to lower a weight than it is to hold a weight statically. So you're going to first lower down to the point where you can comfortably, then you're going to hold isometrically in that range. And by doing that isometric hold, you get a little bit of overflow. So you get strong in this range and about 15 degrees above and 15 degrees below. So you get stronger in this range of motion, and then you can come down just a little bit farther. And then hold that position isometrically for about 10 seconds. And then come down a little bit farther. And then hold that position isometrically. If you get tired and your legs get tired and shaky, don't go to the point where you're going to fall. In fact, when you're doing this, I would recommend doing it with a chair behind you. So going down and holding statically. Come down a little bit farther and hold statically. If you happen to get too tired, you need to sit, you just have something to sit down on. But you're going to go through that position. You're going to lower, hold, and then lower a little farther and hold. And again, remember to keep the knee-toe alignment. You don't want your knees going too far forwards. You also don't want your knees to come in this way. So go down and hold. Go down and hold. Go down and hold till the point where you either start having knee pain or you just feel like your legs aren't strong enough to hold you. Then you're going to press back up through your heels. Try to come up as fast as you can. It takes more force to raise up quickly than it does to raise up slowly. So you're going to try to push as fast as you can back up. Then lower, hold, lower, hold, lower, hold, and then push back up fast. And lower, hold, lower, hold. And you can go as deep as you're able to go. If you can get into a deeper squat and your knees allow you to do that, then go ahead and get as deep as you can and then come back up fast. So those were the 2 exercises that biohack your nervous system and allow you to get better flexibility and strength out of your knees while also helping to decrease your knee pain. Now, if you do need more help for knee pain and you're in the St. Louis area, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.